Now, Al-Quds Hospital in Gaza City is the latest health facility in the enclave to report it is no longer operational due to a lack of fuel and power. Israel's military has offered to evacuate babies from Al-Shifa Hospital, where officials from the Hamas-run Gaza Health Ministry have said 2 newborns have died, and the Palestinian Minister of Health has said 12 people have died after its fuel and power to the hospital ran out. Well, joining me now is the Israeli Defence Forces spokesperson, Lieutenant Colonel Richard Hecht. Thank you very much indeed for joining us. Certainly, the situation at many hospitals in northern Gaza, especially Al-Shifa, seem to be growing increasingly desperate. Now, the IDF has said that babies will be evacuated from Al-Shifa. How do you plan to do that?
So, yes, the situation is pretty dire. Sadly, Hamas have been manipulating these hospitals. I would also mention that Rantisi and Nasser Hospital have been evacuated after we asked them to leave. They moved down south on the humanitarian corridor. Shifa, yes. We are now in contact with the hospital to try and solve this issue, also with energy and also with the babies. We said we'd try and assist this effort. And this is ongoing right now on the ground as we speak, Sally.
We're hearing from the Palestinian Health Minister that 2 newborn babies have already died due to this lack of fuel at Al-Shifa Hospital. There is no time to waste. When do you plan to carry out these evacuations?
So this is we understand the timeliness of this, and we're working very hard to try and coordinate this effort. There'll be more information coming on that. We are not trying to target the hospital. We are trying to target the terrorists that are hiding under the hospital and within and near the hospital. That's the tragedy and the dire situation of this conflict.
Yes, but patients and extremely sick people are being caught in the crossfire, including newborn babies in neonatal care. If indeed you do evacuate these babies, where will you take them?
So I can't share that information. This is something that will be developed within our diplomatic efforts, and there'll be more to come on that, Sally. It's something we can't share at this point, how we're going to do this and how it's going to happen. It's still being developed.
Why do you not just give Al-Shifa Hospital fuel so they can keep these generators and life support machines going? Surely that would be easier than trying to evacuate newborn babies needing life support care.
So we're communicating with the hospital and trying to find ways to support the pediatric area in the hospital with the babies. That's all I can say.
Now, the chief of Israel's armed forces, Herzi Halevi, said that there would be a willingness to provide fuel to Gaza's hospitals if indeed they ran out. That day has come. Hospitals have run out of fuel in Gaza and they are ceasing to operate. Patients, newborn babies are dying. Will you allow fuel to be resupplied to hospitals in Gaza?
We are doing everything we can to support the hospital, Sally. As I said before, that's all I can say at this point. I would remind everyone that we also have a 9-month baby within the 239 hostages that we have. I mean, this is a tragic and dire situation for both sides. We are not fighting the babies or the civilians. Sadly, the Hamas, instead of surrendering and coming out of the hospital, they're hiding within the hospital.
Yeah, indeed. As you say, you've got a 9-month-old baby yourself that's being held hostage in Gaza, and there are newborn Palestinian babies dying. Would a ceasefire not be preferable, and to allow at least some safe evacuation of children from Gaza, whether it's Palestinian children who are extremely sick or injured, or your own children who've been taken hostage?
Sally, so we've done everything we can. We've done tactical pauses, also in areas in the north, in Jabalia today. Also, we've created a safe passage route from the Shifa hospital so they can connect to these humanitarian corridors that are open for 5 hours each day on the Salah ad-Din road and also on the Al-Ghasha road on the coast, so people can move south. We've been asking and pleading for weeks for the people to move. And this is Hamas's responsibility. And not only that, 14,000 tons of humanitarian aid have come into Gaza. 2,000 tons of that medical equipment. a humanitarian zone on the coast near Khan Yunis in the Moasi. We're really doing everything we can to try and differentiate between the civilians of Gaza and the Hamas who attacked us on the 7th of October.
You say there's a humanitarian zone near Khan Yunis in the south of Gaza. Why is that area being bombed by the IDF?
Categorically, we're not bombing it. We want it to be a humanitarian safe zone. Sadly, there was one case where they fired from that zone, and we specifically targeted the target.
We're hearing unconfirmed reports as we speak, Lieutenant Colonel, that the IDF have entered Al-Shifa hospital. Members of the Israeli Defense Forces now inside Al-Shifa hospital, according to unconfirmed reports. Can you confirm that?
I cannot confirm that, and I'm not aware of us entering the hospital.
Do you plan to take control of Al-Shifa hospital?
I will not lay out here our operational plan, where our goal is not to take over hospitals, Sally. Our goal is to dismantle terrorist infrastructure. There's no goal for the IDF to come and conquer a hospital, just like we didn't do in the Nasser hospital and also in the Rantisi hospital. We just asked them simply to evacuate it south.
You say hospitals are being used by Hamas, that Al-Shifa has a headquarters underneath the hospital. If that's the case, can we assume that at some point you will enter the hospital to try to root out Hamas, and presumably you'll need to take control?
We will use a disruptive way to root out the Hamas activity, and we'll do everything we can, understanding the sensitivity of the hospital, to deal with the terrorist infrastructure within and underneath the hospital.
We're also hearing reports that you could be getting close to a deal on a hostage release. 50 to 100 Israeli hostages, women, children and the elderly, could be released under a deal that is currently being discussed. What more can you tell me on that?
All I can say as a man in uniform is that our military mission is to destroy Hamas and get our hostages home. About the details of that, these discussions and these things that you just mentioned, they are not happening in the military or in my lane.
Regarding sick patients and very injured people, and we're talking people on life support in Al-Shifa and Al-Quds hospital, who presumably are being affected by the fact that they've run out of power. Are you still expecting these hospitals to be evacuated?
Yes, we are, and we're aware of how complicated it is. Our civil administration people are trying to find solutions to do this. And again, I'll say, I look at the intelligence and the coverage and the movement of people on the routes, to include Hamas. They can still move around. They can still do that. It's their responsibility. We evacuated more than 250,000 people from the vicinity of the north and also near the Gaza Strip. It's their responsibility.
And where are you expecting these very sick and injured people to go when hospitals in Gaza are currently packed?
We're looking for solutions also in the south and also with the international community. And that's all I can say at this point.
OK, Lieutenant Colonel Richard Hecht, we'll have to leave it there. Thank you very much indeed for your time today.
Thank you, Sally.